to this fantastic webinar, The Growth of the Medical Cannabis Industry. And this webinar is brought to you by the Chiba Cannabis Academy, Carol's Oils, and Medical Marijuana 411. I see some of you coming in. Welcome, 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 everybody. We've got about 42 people on this call. Welcome to all of you. No matter where you are in your cannabis journey, you are definitely going to learn a lot on this webinar. So I just want to extend a warm welcome to all of you. And for those of you who have no idea what this webinar is going to be about, you are in for a treat, because today we are going to be speaking about the growth of the cannabis industry, specifically in South Africa. But we'll also be talking about navigating and understanding the legal framework. So what's legal, what's not legal? How do we navigate this very complex legal landscape? We're also going to be talking about cannabis education. This is a brand new avenue and area in education, and we're going to be diving into some of the fantastic and interesting things that you can learn if you choose to study more about cannabis. We're also going to be talking about what is medical cannabis to people who actually need it. So we're going to be speaking about some of the benefits of using cannabis as a patient. And then we're going to be looking at the future of medical cannabis, specifically in South Africa. And we're also going to be letting you know about some of the amazing cannabis training that we are rolling out nationally. We're going to be speaking a little bit about the medical cannabis roadshow. And we will also be giving away a medical professional online course from the Chiba Cannabis Academy in partnership with Medical Marijuana 411. So I hope everybody's comfortable. I hope everybody's got a beverage of choice and that you're ready to learn some amazing medical cannabis information here tonight. So, why is it so important for us to be learning about medical cannabis? I think for a lot of us, we have preconceived ideas about what medical marijuana is or what cannabis is. And now we're going to be speaking specifically about its applications as medicine. And so to kick us off tonight and to introduce this topic to us, I'm going to bring up our very first guest of the evening. Her name is Kelly McHugh. She's a published author of At Home with Cannabis, and she's going to be sharing with us a little bit about her journey using medical cannabis as a patient. Welcome, Kelly. Thank you so much for being here. And why don't we kick off by just introducing yourself and sharing a little bit about your journey and your use of cannabis?
Thank you so much for having me here tonight. Yes, so my story started in 2012. I was diagnosed with breast cancer, and I chose not to go the conventional route of chemotherapy, surgery, or radiation, and instead embarked on the natural route, which was predominantly with cannabis, using cannabis, which I made in my cannabis oil, which I made in my own kitchen. I was able to heal myself within 8 months, and then I went on to help other people to achieve the same, not just with cancer, with a variety of other illnesses. And so then that obviously motivated me, and I really, really felt that this information needed to get out there. So I wrote my book, At Home with Cannabis, which really is designed to assist the average person to be able to heal themselves, improve their quality of life safely and effectively with cannabis.
So just tell us, Kelly, I mean, you get this devastating diagnosis. I'm not sure how you managed to compose yourself and actually come to terms with that reality. But what made you decide to actually not go the conventional route and to choose cannabis? How did you come to that decision?
It was a couple of factors. I had always been naturally drawn to the more alternative medicines. I sort of always was a little bit almost suspicious, I suppose, of allopathic medicines. And then my grandfather 10 years previously had been diagnosed with colon cancer, and he had gone the conventional route. And I'd watched how the treatments had weakened him much more than the actual disease. And I feel that he he told me he regretted going that route. So that was very much in my mind. And then when I did the research and I came across Rick Simpson's video, Run from the Cure, which spoke about using cannabis and showed me how to make the oil, it really resonated with me. And I suppose that is very important when you're choosing a treatment. It made sense to me. So yeah, I felt quite good and quite excited when I started my journey.
Sure. It's amazing. Now, look, I mean, I'm an allopathic doctor. I was trained in a conventional medical school, and I know from personal experience what some of the barriers and some of the challenges that the medical fraternity have with accepting cannabis as a legitimate form of medicine. So just share with us a little bit about what it was like going to your doctor and saying, no, thank you, I'm not going to take the chemotherapy, I'm actually going to use cannabis. Did you find any support in the medical fraternity?
No, not really. I didn't get, no one gave me a hard time about it, but it was sort of, all right, well, good luck. Off you go.
Quite dismissive.
Yeah, I think they just felt that I would be back, probably, and I never was, so.
Wow. So you discovered, you did a bit of research, you learned how to make your cannabis oil. So how did you actually source the cannabis? Tell us about, like, where do you start? Now you've decided to go the medical marijuana route, but where do you actually find this cannabis?
So it was actually, it was pretty easy, to be honest. I had a friend who knew somebody who was able to buy, like, they used to sell them in liters. And oh, sorry, can you still see me?
Mm-hmm. Yes, you're good.
Got a pole on my thing. And so they would sell it in like ice cream tubs, and it was extremely cheap. I can't remember now off the top of my head what it was, but I remember my entire treatment, I think, cost around about less than 2,000 Rand, the entire cancer treatment.
Wow.
So, because back then, before people realized it had a medicinal value, it was cheap as chips. And it was the run-of-the-mill Swazi that I used. It was nothing special. But fortunately, South Africa just does naturally have a very good quality of cannabis. So I was very lucky.
Wow, that's amazing. So now, look, you basically have decided to go this medical marijuana route. You don't have much support from your doctors who've diagnosed you. So how did you actually know that you were making progress in your treatment? Was there anything that you were monitoring, any way that you were actually able to keep track of what was going on with you?
Yeah, so the way I discovered that I had an issue to begin with was I'd gone for a thermoscan, and they had picked up, so it's heat technology, and they had picked up a hot spot in my breast where there shouldn't have been one. And then I took that obviously to my doctors, and that's when we got the diagnosis confirmed. So I used that technology going forward to monitor the size of the tumor, because it was quite clear. So I did it at 3 months, and then again at 8 months, and then check up afterwards. I would go once a year, but it's been almost 10 years coming up, so I don't really check myself anymore. I feel quite good. But yeah, so I use the thermoscan as my way of monitoring my progress.
Wow. And do you have any advice, Kelly? You know, somebody who's sitting at home, or a family member who's just been diagnosed with a dreaded disease, whether it be cancer, whether it be something else, and they may be considering using cannabis as part of their treatment program. Do you have any advice for people like that?
I think my best advice is just to give it a sincere chance. And I apologize with the doctors if this is in disagreement with what you guys suggest, but I would recommend, depending on this, what stage cancer you've got, the severity of it, I would recommend going the cancer route before you do the chemotherapy or even surgery necessarily, depending obviously on your situation. And the reason I say that is the cannabis is going to help to strengthen your system. so that even if you end up having to do the chemotherapy or the surgery, your body is going to be in a healthier state already, just to be able to deal with coping with those treatments. So my advice to people is to really please consider this as a first option, not a last resort. Because that is, I feel, the difference with my story is that I used it as a first resort. And I've honestly gotten healthier and healthier and healthier. I have no fears of it coming back. I don't have any complications because of other treatments. I'm 100% healthy.
Wow, that is amazing. And that's actually a great piece of advice. I think that we generally tend to have an all or nothing approach. And I think that as we learn more and more about the intricacies and complexities of the human body, we're finally starting to realize that there's no one size fits all approach. And really what you're describing is getting your body in a state of wellness so that you give yourself the best chance to actually heal from whatever it may be that you may be afflicted with. So, wow, that's really, really powerful, really, really powerful advice. Thank you so much for that. You were speaking a little bit earlier about the poll that's just popped up, and there are going to be a few polls running through this webinar. And the first question that we asked is, do you know about the endocannabinoid system? Now, I want to just ask you, Kelly, when you first learned about the endocannabinoid system, how did you actually discover it? Or was it something that you learned about really early on? Because this is a buzzword now in medical cannabis. So.
I didn't know about it at first, but the more I researched and the more I looked into it, the Israelis had already been doing work on that. So we already had some studies and some information on that. So that's how I sort of got introduced to the concept. But since then, so much more work has been done and our understanding of it is growing all the time. But I mean, cannabis is one of those subjects that the more you learn, the more there is always going to be to learn. It's a very vast complex.
Wow, that is fascinating. And, you know, that is actually awesome, because I think that one of the things that holds the medical fraternity back, we're going to be talking a little bit about this later, but one of the big roadblocks, I think, is when you go into something with an attitude of, I know it all, there's nothing more to learn. Whereas if you have a more open-minded approach, and I do think that cannabis, in a very weird, beautiful way, opens your mind up in so many ways, that,
Absolutely.
you know, being more open-minded and learning more about it, you actually just fall in love and you just want to learn more and more and more as you go. Well, thank you so much for joining me, Kelly. I really appreciate you. And do you have any final words of advice or any recommendations that you may want to give any medical people who are attending this lecture or this webinar? Is there any, you know, advice from a patient that you could potentially give to them?
Just that cannabis is such a unique individual medicine. And so when it comes to treating your patients, you really need to listen to your patients, because their experience is not going to be the same as everybody else's experience. It's very unique. But if you do listen to your patient and you work with the cannabis, then it becomes an amazing tool. That really, and it's an amazing feeling. I know as doctors, you know this already, when you see something working and something really helping somebody. So yeah, I would definitely suggest just be open to it, and open to using it yourself, please. That is the best way to actually learn how to use this plant, is to use it yourself.
Well, on that note, thank you so much, Kelly. We're going to be moving on to our next speaker. I really appreciate you, and thank you for joining us on this webinar.
Thank you.
Just to share with you guys the polling results of that question, have you ever heard of the endocannabinoid system? 71% of you said yes, 18% of you said no, and 12% of you said, I've heard of it, but I don't quite know what it is. So let's bring on the Fundi in medical marijuana education, the CEO of Medical Marijuana 411, the leading cannabis education center in the world. We've got with us today Christine Nazarenus.
Yes, very good. Most people call me Naz because most people, including my business partner, cannot pronounce my last name. So
wow. Welcome, Christine. Thank you so much for being here.
Of course. Of course.
So, Christine, let's just kick it off, right? We in South Africa are definitely way behind you guys in the US, right? And it seems like South Africa is a little bit slow with catching on to and embracing cannabis education. So, my first question to you is, did you experience something similar in the United States? And how was it for you?
Yes. And a matter of fact, I am right now in Oklahoma City. And I spoke to the state assembly at the Capitol about 2 hours ago about cannabis education. And what's really interesting is that even though globally we're all having this discussion, the discussion is the same. So here, a state that's already legalized cannabis is already having problems because of a lack of education. So they brought me in to talk to all the Senate, et cetera, to discuss the importance of education. So on that note, it really is interesting that we're all discussing it almost at the same time. And we're finding that also out of our Asian team, our European team, obviously, our fantastic partners with Chiba, who can't even thank you guys enough for the association and partnership. But yeah, we're all dealing with this in the same time frame, which is pretty fascinating.
Wow, so you guys are producing world-class cannabis education, yes, which cannot be an easy feat to pull off. So, I guess the question is, how do you remain relevant, and how do you make sure that the information that you're putting out there is well researched, especially when it comes to, medical doctors who may have like a specific bias when they're looking at information? We always want to see the science. How do you make sure that your content is well researched, that it's credible, and that it's relevant?
That's a fantastic question. One, it's always based on cited research citations. And we also know that with cannabis, we need more research. That's one of the problems globally, US with the Schedule I drug situation. By definition, cannabis is listed as a Schedule I drug, which means that it has no medicinal value and it has a high addictive rate, which we now also know that the research doesn't prove that. So it's hard to, that came up this morning, is that why is there only one state in the United States, the University of Mississippi, allowed to grow the research cannabis in the US, and it's terrible. You can go down to your regular dispensary here in Oklahoma and buy better product than you can get from the federally funded University of Mississippi NIDA program. But for us, we always look to the technology. For us, being an online platform was very critical. It was for the reach, the accessibility, and also we didn't want to just read PowerPoint presentations to our audience. We wanted to make sure that it was fluid, it was adult learning. The people that wanted to really dive deeper into the research, they could click on a citation and actually see it. It is a very fluid conversation. Globally, things changing literally daily. We look to, again, technology to be able to push notifications of legal updates in the United States. We're going through a big culling of all of our courses right now to double check citations, add new citations. So it's an ongoing, everyday process. And yes, it is hard, but we're proud to do it for sure.
That's actually one of the things that I really, really love about your courses, is that there's so much a reference to studies that have already been done. And so for those people who really want to dive deep into it, I think if nothing else, your courses are a great reference to be able to look up studies and to be able to get the data that we actually need. So kind of following on to what you were saying about the legal landscape in the US, I think perhaps for doctors in South Africa, because we also still having legal issues in the country, a lot of doctors may be scared to lose their licenses, and so I'm just wondering, how does that, what has that been like for you guys in the US?
It's interesting because that also got brought up this morning. I think it's and this is an estimate, but it's about 83% of all medical professionals are not trained on the endocannabinoid system in medical school. And that's not just a US situation, that's a global situation. It's the largest receptor system in our body and manages everything from pain, sleep, anxiety, your good feelings, just your health, right? And our body produces naturally endocannabinoids. So that's where that mirroring of the lock and key kind of concept comes in. But to, your point of how do you make sure that physicians aren't scared of it, or we're reducing the stigma. I think with applications such as this, talking about it, always putting the education first, and the reality is that the patient is leading the charge. The patients are coming in and they're the ones who are opening up the conversations and honestly making all this legislation and legalization globally happen. The patient, now tends to have more information than a physician, but hopefully the physician is open enough to go, okay, there's got to be something to this. This isn't just somebody saw something on the internet and decided to go for it. So I think that's the biggest part. In the States, we have a legal statute or precedent that's called Conant v. Waters. I may have that wrong, but it's basically that there's a legal precedent that a physician is protected to be able to talk to a patient about cannabis in a legal, even a non-legal state in the US. I know that there's a couple other precedents, that around the world, but we need to dive deeper in that because there has to be protection because physicians are scared. There's a part of it that is a little scary still.
So your point earlier about the fact that we have a paucity of cannabis education. If there are any, doctors sitting on this webinar today who are wondering, okay, maybe you're onto something here. What advice would you give them? Where do they need to start? What are the basics, the key things that you think doctors need to know about?
Yeah, there's a basics course that we offer jointly through Chiba Africa and us, and through all of our other opportunities globally. But I would say for the medical professional certification, in my opinion, is the best course. We have worked jointly to be able to offer accredited programs with SAFRA, CE points. In the US, it's the American Medical Association points. Now, those courses are excellent. And I know both sides are really proud to have gotten those approvals because they're important, right? But those courses are slightly flawed because of the accreditation and the drug schedule that you can't freely talk about dosing and how to medicate. So the medical professional certification, although not accredited, it dives deep. We go in to reduce the stigma about smoking, vaping, what's the bioavailability of how cannabinoids and cannabis reacts with our own system, how to stay safe, start low, go slow. You have to know some of the basics, and we want to make sure that they know, the medical community out there has enough of that foundational education to then we're always developing new courses. So then take the basics course. Let's start with the Med Pro. And that's not just for medical professionals. In my opinion, that's our best, most in-depth course and the best one to start with. And then you can add on to some of the specialties.
Yeah, you kind of touched on it, but I think that still in South Africa, we see accreditation as the golden stamp of approval.
Yep. And we do in the US, we absolutely do. And we need it. And we have to be proud of that because it's hard. You're dealing with not a federally regulated or government regulated substance. So for both of us, it's a huge achievement. So I don't want to take away from it, but again, to be very candid about the pros and cons, this is where you ought to go.
It's amazing because the course that you have partnered with Chiba Cannabis Academy on is actually accredited by the HPCSA. So when I saw that, I was like, wow, this is amazing. More doctors are going to actually want to take this course because here you have our golden stamp of approval on this program. And I think that it's literally just going to be a matter of time because, as you say, patients are really driving their treatment now. And a lot of patients are asking the question. So just perhaps in closing, Christine, any final words of advice for any healthcare professionals who may be on this call who are uncertain about, whether they should or shouldn't? What do you think the future is in cannabis?
Well, for us, one, I'm incredibly proud to be partnered with Chiba. There's not a better partner, people, the whole gamut, and that's a hard, because we're a long way away. It took a lot of trust on both sides. Two is that the accreditation is difficult. To have those accredited courses available is huge. And the third is that, we guarantee your satisfaction. We've never had a return. I mean, that's the bottom line, is like, we're going to stand by what products and what materials are out there. That's just who we are as a company, who we are as partners, and what we're doing and what we're offering.
Oh, fantastic. Well, thank you so much, Christine, for sharing some valuable information and insight into what people can expect on the inside of your courses, just in case there was anybody sitting on the fence. And just a reminder to everybody, we are going to be giving away one of the courses that is offered by Chiba Cannabis Academy in partnership with Medical Marijuana 411.
And how about this? I'll match that. So we're going to give away 2.
Wow, that's amazing. So guys, don't drop off this call. Stay tuned until the end, because we're going to be giving 2 courses away to 2 very, very lucky webinar attendees. So thank you so much, Christine. I really, really appreciate having you here. Thank you for sharing your time and your insight with us.
Absolutely.
And so we're going to be jumping right on to our next session. And I have got with me 3 incredible doctors in their own right. We have got with us Sharon, Carissa, and Gogo. They are a mixture of allopathic and traditional doctors, and they are coming to join me to speak to you guys a little bit more about medical cannabis and their experience with cannabis as doctors. So we've got Dr. Carissa here, and Dr. Sharon, and Dr. Gogo. If you guys can perhaps introduce yourselves, let's start with Carissa.
Hi guys, hi Carmen, and all the attendees. Thank you so much for having me today. Just a little bit about myself. I am a traditionally trained medical doctor. I feel like that's such a bad thing these days. But I have a special interest in chronic pain management with a view on holistic patient management. I had my love affair with cannabis actually got serious in 2016 when I was diagnosed with my own malignancy. And I, as one does, start researching and reading and realizing that there's actually such a big lack of information and education specifically, which then led me to find Sharon's course way back in 2019. It feels like forever ago. And I eventually did the Medical Marijuana 411 course. And I'm so happy that there's a combined course for all of us to sort of put everything together. It's an incredible time to be alive. So yeah, that's it. I'm a pro-cannabis advocate for all my patients, and being a consumer myself, I've definitely used cannabis as an adjunct to the traditional allopathic medicine in my journey, unlike what Kelly was explaining. So I think, that there's a place for both to work hand in hand. So that's me.
Awesome.
Thanks.
Thank you for being here, Carissa. Sharon, would you like to go next?
Hi, everybody. Thanks, Chiba, for this amazing opportunity, and everybody on the panel. It's really exciting. I'm a traditional doctor. I've been working in the cannabis industry for the past 15 years. I literally have been working with patients for the past 15 years. I'm not only working with cannabis, of course, cannabis is quite an incredible healer, but I do believe it's not just the magic bullet, not the only answer. But yeah, I've been training medical doctors for the past 9 years. It's been really beautiful to see their reactions, and when they do know a bit about it, how they race forward and embrace this beautiful plant. Thank you.
Awesome. It's awesome to have you, Sharon. And Gogo, your video is off. Would you like to join us? Let's see you.
Oh,
there you go.
sorry,
Hi.
I was just trying to walk. Oh, okay. Good evening, everybody. Thank you so much. May I just say that as I speak, I will be burping a lot. So don't think I'm eerie or weary. That's just who I am. So I am Dr. Gogo Mokhach. I am a qualified medical doctor who has stopped practicing Western medicine and took the lead to be a traditional health practitioner. And I am an advocate for marijuana and uses it in my practice. I have left the Western left Western medicine to practice as a full holistic healer. I call myself a holistic healer because I combine a whole lot of healing modalities, such as Ayurvedic medicine, homeopathic medicine, and other modes of medicine, including Western medicine. A little bit, I did say that I have stopped practicing because I had to take heat into the core. And you would know that we as traditional health practitioners, as it is a new term being given to us to address sangomas or people with a traditional calling in their different classifications, we do use marijuana as a base for as a root medicine to heal a lot of ailments that we come across. But the issue that we have as THPs that I'm working with Traditional Healers Organization is to ensure that we are recognized and a license is given and that proper registered healers are given. So you would find that traditional healers are having a problem in accessing cannabis or using it in their different practices or surgeries because of how it has been the regulation and also the licensing. And that's what we are working with Traditional Healers Organization, because what we need to be doing is what we've been advised to do is to professionalize, or rather find a body that all traditional healers are registered into, and that then we can be able to give licensing. So that, but we prerequisitely use cannabis. Oh Lord, we prerequisitely use cannabis in our practices. So that's a little bit about me.
That's amazing.
Yeah.
Thank you so much. I'm sure everyone will agree who's on the call that this is a fantastic panel, and I think that you guys are absolutely perfectly poised to speak to everybody in attendance about medical cannabis and its uses and benefits. Perhaps let's just kick off, Sharon, maybe you can tackle the first question that I have, which is, what exactly is, especially for the people who are a little bit unsure about what on earth is going on with the legal landscape of cannabis in this country. So at the moment, what is the legal landscape and the legal status of medical cannabis in South Africa? And specifically, maybe you can speak to SAPRA and Section 21 as well.
Okay. Well, right now, unfortunately, medical cannabis has not been addressed at all. In the last court case they addressed recreational cannabis. So I think we have a long way to go still, but again, the patient is pushing this. So right now we are able to apply for a Section 21 through SAPRA to use THC in particular, which is what most chronic diseases actually need. We're unhappy about the Section 21 application. SAPRA has tried this before and not many patients got through. So what we would like to appeal to SAPRA for is basically having a compounding pharmacist that can hold stock. And that would allow doctors that are trained, obviously, and practitioners that are trained to actually prescribe the product and know that the patient's able to go to the compounding pharmacist and collect their medicine. I think millions and millions of people are using medical cannabis in South Africa. And because of prohibition, they are ending up sometimes buying the incorrect products from the street. So I'm really hoping that in this new year, SAPRA will come to the table and look at something that's actually going to help the medical patient. We are really happy that recreational cannabis is legalized, but I personally would have addressed children first. I would have then addressed medical cannabis, and then I would have addressed recreational. But we're all in the beginning of a long journey, I think.
Yeah, so I think that there has been a lot of buzz, of course, with CBD. You touched on a very important point about THC. But I think that, you know, with the advent of CBD becoming quite easily available now, everybody's buying CBD products. They're all over the shelves in pharmacies and that in health shops and that kind of thing. I think that there has been a lot of buzz around cannabis from a CBD perspective. But perhaps, you know, in your practices, anybody can really answer this question. Aside from the buzz that I think that a lot of people are playing into, has there been an increased demand or questions coming from patients? Have you noticed that there's more interest in cannabis than there perhaps once was?
Yes, absolutely. Somebody else can answer that.
Yeah, absolutely. We are finding that in the traditional space, patients with what we would medically term carcinomas, cancers with us, especially females, are really asking for the use of cannabis. It's good that doctor is speaking about THC. The problem also is in the traditional healing space, especially with African traditional indigenous medicine, is that they need the natural intelligence. So the naming, the identification of the species becomes also difficult to identify what will be the opium level within the drug. But yes, to answer your question, we are finding I'm finding that in my holistic clinic that a lot of patients are actually requiring it.
I'd love to answer this question because I've noticed a trend even before it started, you know, with the legalization of the recreational or responsible adult use, where patients would generally wait till the end of the consultation, sort of those door handle questions. Oh yes, doctor, what about cannabis? What do you think? And I think a lot of it, a lot of the patient's forthcomingness depends on how forthcoming we are and our body language and our response and sort of our education. So if as medical professionals, we are generally more open-minded, we are actually well-informed, we can then guide patients to make informed decisions. And I think that's the important part, you know, is gauge the interest and then follow that lead. I think generally patients take the lead also from us and how we respond. So I've definitely seen an increase in patients asking, and not just for malignancies, cancers, that kind of thing. We are looking at things like chronic pain and epilepsy and all of the other things that cannabis is very good for.
Interestingly, on the poll, 36% of people, so the question was, are your patients asking about cannabis? And so 36% of people said yes, but only a few. 16% said not at all. But 48%, so the majority said yes, and it is on the increase. So that is both exciting and scary at the same time, given what Christine said, and I think everybody here will agree, that when it comes to using cannabis as medicine, you really have to know what you're doing. And so it is important for healers to be educated with regards to how they can guide their patients, because otherwise we're going to end up in situations like Sharon mentioned, where people are just buying the wrong thing off the street. So why has it been so difficult to get the medical fraternity to embrace cannabis? What are your thoughts about why this has been so difficult to kind of push through that barrier? Because there very clearly is a barrier when it comes to especially allopathic doctors. I find that alternative healers generally tend to be a lot more open-minded, but specifically allopathic doctors, what do you guys think are some of the factors that will prevent them from embracing and being more open-minded about the use of cannabis as medicine?
We're doing it like this because it's always been done like this. And I think that's one of the biggest causes that's detrimental to our patient management in the bigger scheme of things and what's in their best interest, actually. I can speak from personal experience in that when I graduated in 2007, cannabis training education. I think it was 2 lines in our anesthetic module, and we didn't really talk about it. So training in terms of the use of medical cannabis is very little. Although these days, I think they've got slightly bigger paragraphs. So that's the one thing. I think, as you mentioned earlier, Carmen, it could also be an individual ego thing. I know it, and I know that these drugs work. And I don't think this works. Obviously, there's also the stigma around cannabis because of prohibition. And we know that paradigms and mind shifts are slow to change and difficult to shape, but change is coming. You know, and I think it's just a lack of knowledge around it, and fear. Fear is a very big driver as to why health professionals aren't, you know, engaging in active conversation.
Sure. Yeah. And as Christine said earlier, that now we're in a situation where patients are actually driving that conversation. A little bit more forthcoming, a little bit more upfront now, and very much interested in taking control of their own healing. I'm not sure if you have anything to add to that, Sharon or Gogo?
I certainly do see that the patients are driving it, Carmen, but right now, some of the doctors that we trained in the past are totally actively involved, even although they stand the risk of losing their licenses. They you know, some of these doctors have, over the past 10 years, had absolute full cancer cures without chemo and radiation. So those are the guys that become proactive. At the end of the day, I think what Chiba is doing here with the training is going to turn things around radically. First of all, doctors want those CPD points. They want to know that their training has been certified. But mostly, doctors are realizing, I'm seeing it hugely, and I'm working with, I don't know, I don't want to exaggerate, but well over 1,000 medical doctors. I'm seeing that they are wanting to prescribe, but they're wanting the education. So once they feel more comfortable and more trusting, they're gonna go for it. I know that the big pharmaceutical companies are not excited about this, because basically a cancer patient, for example, arrives and he needs an antidepressant and a sleeping tablet and a pain reliever and an anti-inflammatory. Let's not even begin to talk about something that's called THC that causes apoptosis of the cancer cell. And those are 6, 7 different medications that big pharma are losing right now. So really, and this is done, as Kelly said earlier on, she did it in her kitchen. I'm not suggesting that anybody does this in their kitchen, really. Work through a medical doctor, because there are many trained medical doctors in South Africa. But it's coming.
So Sharon, I think that given your line of work, educating doctors, I think the people who come to you are really hungry for that information, and they're ready to go, and they want to learn as much as they can. But what about the doctors that perhaps you meet that are not coming to you for education, and perhaps, you know, there are people you meet in social circles, or people that you've heard of that are treating other patients, or people, friends that you may know. Do you think that the medical industry is still viewing cannabis in a very negative light, or do you think that that is actually shifting?
I do believe that it's shifting, Carmen. I think a lot of the more old-fashioned doctors that are not prepared to look out the box are always going to stick to their guns. But because they're seeing so much happening, and we're working with some really conservative doctors, that I'm surprised that they would even take the risk. But they are, because they literally, you know, within 5 days, one starts seeing huge changes in the patient's vitals. Within the first night, they sleep better. You know, the people that go for chemo suddenly have an appetite after using cannabis. So at the end of the day, I think what's going to get the doctors standing up is SAPRO giving us this compounding pharmacist and allowing us actually to move forward on this, because it is being sold everywhere. cannabis has been sold legally all over the world. There are many clinics that have opened. Once that happens and more doctors are educated, you're going to have, there's going to be a storm, and I reckon that storm is going to be next year already.
Yeah.
Coming.
So here's a interesting poll that was asking, can THC cause apoptosis of a cancer cell? 29% of people said yes, 15% of people said no, and 56% of people said I am not sure. And this, I think, really just highlights the importance of education. And, you know, this is a topic that is covered quite extensively in the medical marijuana and the Chiba Cannabis Academy courses. And I think that it really highlights the importance of why it's so important to be informed as a healer, because patients are going to come to us and ask us these questions, and it's up to us to actually have these answers on hand. So perhaps we will get into a little bit more about perhaps some of the uses of cannabis and the applications and the benefits and some of the protocols that can be used as part of treatment and management of patients with different ailments. But perhaps, Gogo, if you can speak to us a little bit about how cannabis fits in to indigenous knowledge systems as a traditional medicine. Are you still with us? Yes, there you go.
Is my mic on? Oh, yes.
Yes.
Okay. I think, you know, cannabis fits perfectly well into to indigenous and traditional medicines. In effect, that we use it as a base. For instance, let's take the traditional call within the African spectra. We would have some of the initiates experiencing anxiety, experiencing some sort of mental illness, and you would find that some actually, when it's used, cannabis used in a proper directive manner, is able to ease their anxiety levels. Because remember that we are talking about a person who's moving into different dimensions, who also need to come into the physical and operate in the physical. So it also becomes a relaxant that in that regard. But also it's a fundamental medicine with respect to the fact that in whatever we do need some bits of cannabis. But you see, the problem with traditional indigenous medicine is that there are no clinical trials to verify treatments, to say that this is what, if we've used, say, and also remember the terms of naming species, because somebody could be speaking of Mhlonyan or somebody could be speaking of whatever. The terms, the clinical terms, the terms that are being used is not the same in the medical terminology. You've got one medical term, and that is what is used. Pharmacokinetics will use one medical to classify a drug, whether it's non-generic or not. So also with traditional indigenous medicine is the naming, the classification, medical formulatory that is not being formed. So as a result, we look at systems of traditional medicines or indigenous medicine and look at it because there's no clinical verification or clinical trial to say that it has been done. But it is vital that cannabis is given to traditional health practitioners, but also it should be regulated, because we know of what happens outside, and it should be given to proper people. And we are aware of we are really working in trying to get a one body that recognizes, professionalizes traditional healing as a space, so that traditional health practitioners can function, because they've got their surgeries, they've got their clinic, they've got cannabis as a fundamental medicine and ingredient to whatever medicines, pharmacokinetics that they are prescribing, or healing modalities that they are prescribing but they are not being legalized or registered. And you then have the big people that you are fighting with, separate other people that you are fighting with. It becomes yeah, that's what I've observed in traditional indigenous medicine.
Sure, yeah. So it seems like some of the challenges that you experience in your practice are parallel to some of the challenges that perhaps the rest of us are also experiencing. So maybe let's begin to unpack in your individual practices, in your personal space, you know, when a friend asks you, when patients come to see you, what are some of the indications that we can use cannabis for. Now, I love what Sharon said in the beginning, which is that, and I think a lot of people think that cannabis is a panacea, right? It's a cure-all. It's the thing that's going to make everything better. And we definitely know that that's not true. And I think Carissa and Gogo mentioned the importance of being holistic in our approach. But what are some of the things, some of the conditions, ailments, what are some of the patients that you've treated in your practices, and where have you seen some of your best successes?
I think in our case, in Carol's Oil, it's been cancer. It's just been quite incredible for cancer, but really not like that magic bullet, Carmen. It most certainly involves protocols. It involves so much diagnostics, honestly, to find out exactly where the patient stands. So at the end of the day, cannabis is amazing for seizures. It's amazing, but for example, Dravet syndrome, you can't use a normal THC cannabis for Dravet syndrome. So there are different strains for different, certainly different diseases, but it's amazing for cashier disease, gets people munching from the first dose. There are just so many things. Remember, our body is so rich with endocannabinoids. Our eyeballs are covered in endocannabinoids, our liver is, and so on and so on. So cannabis touches so many parts of the body. It's an adaptogen. It's a huge adaptogen.
So for those of us perhaps who are a little bit unsure what an adaptogen is, maybe, we'd like to unpack that a little bit. And I think also perhaps, Sharon, to touch on some of those protocols that you mentioned, just maybe not going into too much detail, but what it would perhaps look like. Somebody came to you and said, I've been diagnosed with this type of cancer. What are some of the things in that patient management that perhaps you would try to work on to try and generate wellness in that person?
So, Carmen, the first thing that I would want to know is what type of cancer it is. You can't give any ratio of cannabis to any cancer. For example, breast cancers in particular, or any hormone-driven cancer. The moment you give it a high THC oil, you actually drive the hormones. So it can be quite dangerous, and I do get nervous for a patient. So really, at the end of the day, there's a lot more than just any strain going to any disease. So I would first look at that, what type of cancer it is, and then I would be able to decide what type of cannabis to give them. And then in a normal intake form, we ask the patient, do you have an appetite? Are you sleeping? Are you stressed? And so on and so on. And we then address each one of these. And the beautiful thing about cannabis is it addresses so many things at the same time and immediately begins to balance the body. And that's what I mean when I speak about an adaptogen. So things we want to be careful with, because cannabis balances the body so quickly. Within 5 days, things are happening. We have to be extremely careful with diabetic people. So we've got to keep an eye on their insulin levels so that they can adjust their insulin levels, because we're treating them for cancer on the one side, and on the other side, we're busy changing the insulin levels and actually changing their diabetes, often quite by chance, just curing the diabetes on the side. Blood pressure, we want to be careful with people with blood pressure. So it really is, it's more about precision medicine, Carmen. It's more about really looking, every patient is different. You can have a patient come with the same cancer with a completely different body status.
Carissa, you mentioned earlier about your interest in pain management. And so perhaps you can speak to us a little bit about your experience with your patients and how you would guide a patient who is perhaps looking at adding cannabis into their regimen.
So I think I have to start with a little bit of a disclaimer off the bat. The IASP, International Association for the Study of Pain, so the regulatory body in South Africa for pain, their current recommendation is that there's not enough robust scientific evidence to recommend for the use of cannabis in chronic pain. But I think this is where it's important to remember that we are treating individuals, right? And I also think that it's useful that we don't stay in a lane where we are necessarily always evidence-based. I like to think of myself as evidence-informed. So I look at sort of the research and then apply it to the patient individually. Chronic pain is incredibly complex. I'm sure, you know, we all know we've dealt with chronic pain patients because it's so multidimensional. And I feel that the longer the pain carries on, the bigger role the psychosocial factors play. So we're not just working with biological stimuli, we're working with everything else, all of the other stress that we have to deal with and the dysfunction and the disability that goes along with the pain. So part of my job is not only to decrease pain intensity, but it's actually to look at the dysfunction that's being caused by the pain as well. So that's one aspect, and we're looking at things like sleep, like Sharon mentioned, what it's also good for. Everywhere that we've got cannabinoid receptors, that's where it would work. So whether it's in the periphery or in the immune system with our CB2 receptors, or whether it's in our central nervous system with our CB1 receptors, that's where it's going to have its effect. And we've got receptors absolutely everywhere, including, I'm sure you know, our cardiovascular system, our reproductive system, our GIT system, our musculoskeletal system. So pretty much where you've got the lock, you can get a key. We make our own cannabinoids. We can take phytocannabinoids, the ones that we get from the plants. So I think it's just incredible. I'm still blown away every single day.
Sure. Wow, that's incredible. Our poll, the latest one, the question was, does one have to take cannabis oil permanently for chronic diseases? So 38% of people said yes, 30% said no, and then 32% said, I think so, but I'm not sure. So it's pretty evenly split. So what do you think about the use of cannabis? So we're speaking a lot about using cannabis for specific ailments and treating particular illnesses. But what would you say to people who just really want to incorporate cannabis into their lives as part of a wellness routine? Is there any advice around that?
Carmen, I think everybody should really be taking cannabis because they have endocannabinoid systems. What we're looking forward to in the future, and we don't actually have it in our hands yet, but is a DNA test. Some tests have been done already in South Africa, but we're looking for a DNA test that can tell us exactly what everybody's endocannabinoid status is. So some people will come along and their anandamide is topped up in the body. If we could test it like that, it's again, when we could test it, should I rather say, it's going to change everything. We're going to be able to give a person a plant that is designed to talk to their body in particular. It does saturate though, Carmen. You don't have to use cannabis permanently. For example, a typical cancer patient, I'll speak about my mom. She had pancreatic cancer. Again, Kelly also said 8 months. It seems to be the magic number, not with everybody, but my mom had a total turnaround of pancreatic cancer over 8 months with a team of 7 medical doctors, 3 oncologists, 2 medical doctors, and myself working. So there was no confusion as to whether she had it or not. She doesn't need to use it every day now. She likes to have it nearby. She's 84. She got the cancer when she was 74. So she uses it more as a sleeping, instead of a sleeping tablet, instead of an anti-inflammatory, instead of blood pressure tablets, but not like she used it when she had cancer.
Wow.
So your body saturates, it stores in your fat cells, and it actually saturates. So even a cancer patient, when they've done their protocol, there comes a day where they just take that extra drop and they just become overwhelmed. It creates Herxheimer disease. which is a temporary thing. We just stopped in for 3 days and everything resets.
You touched on, Sharon, anandamide. So for those people who have no idea what anandamide is our own endocannabinoids that mirror THC, which is in the plant, right? And so this is one of the fantastic things that you will learn if you were to take one of the Chiba Cannabis Academy medical marijuana courses, which I encourage everybody, if you're a healthcare provider, if you provide medical advice or treatment or any kind of medical support for anybody, I would strongly encourage you to take one of the Chiba Cannabis Academy courses. They are truly jam-packed with information, and you really will be blown away by what you didn't really know about medical cannabis. But two people who will be learning about anandamide and a lot more about medical cannabis are our two winners, and I've got them right here on my phone. So I'm ready to announce those, and then we're going to go into our last question, or our last question for the panel before we take questions from the audience. So if you have any questions, please feel free to leave them in the chat. We will try and answer as many questions as possible, but I do have to announce our two winners for the day, which are Mpho Mahlangu and Dipuao Nasoro. I hope I haven't butchered your name. So Mpho Mahlangu and Dipuao Nasoro, congratulations. Let's everyone give them a round of applause. Yay, well done. You guys are going to get the Chiba Cannabis Academy medical marijuana courses. Now, just to give you guys a little bit of a snippet about what you can expect, we are currently about to embark on the roadshow, which is very exciting. Which is the 2-day seminar roadshow that is in combination with the online course. So just a very brief summary about some of the things that you can expect within the course. It is a 20-hour self-study online course with CPD points attached. So that's very important. Anyone who's lacking on their CPD points and you're looking for a way to top it up, this is a fantastic way to do that. The course is recognized by the HPCSA. You will be learning a lot of amazing things, including what is the endocannabinoid system, what is the legal landscape about cannabis in this country. You'll also be learning about clinical practice, about laboratory testing, about dosing methods. And if you are able to come to the live presentations on the roadshow, I would strongly encourage you to do that. The dates for the roadshow are as follows. We are going to be in Durban on the 12th and 13th of November, in Johannesburg on the 19th and 20th of November, as well as in Cape Town on the 26th and 27th of November. So if you're looking for more information, please visit Chiba Africa's website for more information on that. And congratulations once again to two of our winners. Now, the final question that I have for you before we take questions in the Q&A is, what do you think, perhaps Gogo, you can start off by answering this question. What do you think the future is of medical cannabis in South Africa?
You know what? I think if we can all collaborate our healing modalities and actually work in doing what we call holistic practitioning, meaning Western medicine meets with indigenous medicines, and we collaborate and discuss the effects of each treatments that we all offer in our different capacities as health practitioners. Then I think if we could all take it in that way, not say that one is allopathic, one is homeopathic, one, then we would get to a point where we actually get to a point where we treat different illnesses in more effective way. Now, I'm a huge believer of holistic medicine. I'm a huge believer of integrative medicines, because I believe that we could, as Western medicine, we could have protocols to say this is a protocol to perhaps give treatment to adhere to give to a person with tuberculosis, or to give to a person with a carcinoma, and then as a homeopathic I can also give whatever, and then it could actually work if it's integrated. But we speak of drug interactions, we speak of pharmacokinetics, and we don't sit as practitioners, because we are health practitioners. Our main job is to heal. not to continue the symptom, not to alleviate them, but we need to alleviate whatever is there, in all honesty. If we could do that, I think, and incorporating cannabis as the soul of some of our healing protocols, I think we'll do a great job.
Awesome. I want to live in that world where we all integrated as one. Carissa, for you, the future of medical cannabis in South Africa and beyond?
Oh man, I love what Dr. Gogo said. I think only through working together are we going to be able to achieve what we want, moving cannabis out of this dark, sort of stigmatized, this dacha, dacha. It just feels like guttural, the dacha couple, Myrtle explains it beautifully, that dacha, that dirty, stigmatized. I want it to be normalized. I want patients to be able to come to me and say, I'm on my blood pressure medication and I'm on cannabis, and like it's normal. I want us to normalize the use of medical cannabis. That's it.
Oh, beautiful. Sharon, anything to add to that?
Carmen, I can just say that it's not going away. Definitely not. Worldwide, it's not going away. We have patients coming in from all over the world. It's not going away. It's not going away because of the man on the street. When you find yourself in a corner with a terminal disease and you only have one way to go, and that's forward, it doesn't matter whether you're a magistrate, a policeman, or the president of the country. They're using cannabis. The whole lot of them are using it because it works.
I love that. And I think that, for some of us, and as Carissa said, it's not a last resort. It shouldn't be the last resort. It should be something that we actually think of normally. It should just be a normal part of how we think about patient management. So fantastic. Guys, you have been amazing, an incredible panel of really well-educated, poised, extremely articulate, and I love the way each of you speak with such passion. And I think that if there's one thing that we need in the medical cannabis space is absolute passion, not only for the plant, but for our patients. And I think that we are the advocates of the people who are coming to us for help. And I think that as more of us start to embrace medical cannabis, I think that we're going to start to see a huge shift in chronic illness and in wellness in general. So let's go into our very first question of tonight, which is coming from Norman Nyazema. And Norman says, this is a little bit of a tricky question. I'm not sure if anybody can actually answer it, but the question is, what is known about the proportion of opioid receptors versus endocannabinoid receptors in the body? I think it's quite a technical question, but perhaps if anyone wants to see how they can give Norman an answer to his question, or perhaps even just to speak a little bit about these receptors and how they actually interact with each other in the patient. Anyone?
Carmen, it is a difficult question again because of not having the equipment to actually measure these things. This is again where we want that DNA test. What I can say is that the THC, again, that particular component, and I'm never speaking about a part plant medicine when I speak about THC. I speak about THC with all the other cannabinoids. It communicates beautifully with those opioid receptors. I have seen people, there's a rehab actually, I can't really say where, but there is a rehabilitation center that particularly works with opiate addiction. And they are taking people off opiates within 3 to 4 days and putting on cannabis. They don't like each other. Cannabis and opiates don't like each other. They do cause nausea when the two work together. But I think the days of opiate addiction are going to also be gone soon. Thank you.
Yeah, I think that that's a fantastic point that you raised there about opioids and the reduction in dependence on opioids when you introduce cannabis. I think that it's very classic in the United States where there's an opioid crisis. you can see in those states that actually legalize medical cannabis, this drop in the amount of opioid associated deaths that take place. And so I think that that's a fantastic graph to kind of superimpose, you know, the legalization of cannabis coinciding very clearly with the reduction in opioid associated deaths. I think that that's a fantastic testament to the power of cannabis. So here's a question from Ash. Ash says, good evening, Dr. James. Thanks for a very insightful webinar. I have a question for the guest doctors on the panel, if they would be so kind to advise. Can cannabis assist with rheumatoid arthritis? That's the question from Ash.
May I answer?
Okay.
Yes, that's a very good question. I'm sorry, guys. I keep on moving because I'm in a very different place, so my lighting keeps on. So please apologize on that. But on rheumatoid arthritis, I actually have 2 clients that I've assisted with cannabis, and of course some mixture of other herbs. So it does help, but cannabis was the main focal treatment. Stop. So it was a focal medicine. So it does help. Because they were clinically diagnosed, and we had to step in and actually give alternative medicine. But also another thing that we did, we had encouraged our patients was that we are not saying stop your treatment for rheumatoid, but use cohesive stop German. So yeah.
So, Dr. Carissa, we know that, of course, rheumatoid arthritis, chronic, it's one of the causes of chronic pain, I suppose, as well. So, any experience with cannabis?
So I think rheumatoid arthritis is an excellent example because it's an inflammatory arthritis. And cannabis being a potent anti-inflammatory agent, and what you mentioned earlier about an adaptogen, about maintaining homeostasis and helping the body to cope with stress, both mental and physical. I think there's definitely a place for cannabis in rheumatoid arthritis, both for pain intensity, for the disability associated with it, for the associated mood disorders that eventually go along with chronic pain. I think it touches more than just the pain itself. But that in itself, it's really a good anti-inflammatory for that, in conjunction with other modalities as well.
Wow, you touched on earlier about how the longer the pain is there, the more the psychosocial impact is. And I think that's a classic example, because we know that, you know, as pain, chronic pain, as sufferers experience it for longer and longer, we know that it affects mood, it affects their day-to-day lives, just being able to do things around the house, it affects their self-esteem, etc. So I think that is a fantastic example of how cannabis can help to support somebody with chronic pain, such as in rheumatoid arthritis. So here's a question from Norman. So another question from Norman. He says, Dr. Gogo, this one's for you. As you know, there are different types of THPs, those traditional health practitioners. So which type of THP uses cannabis in their treatment and management of which illnesses? So kind of 2 questions there. Which THPs use cannabis, and what do they actually use them for?
Right. Thank you for the question. You see, if I was to speak as a medic, I would tell you which THC it is. But remember, as traditional health practitioners, what we do is we take the medicine, we say the medicine is potent from its natural intelligence. So without reclassifying it, but I'm sure my learned traditional healer will give more into it. I don't want to invade into it as a traditional healer, because remember that the traditional healing space, because I want to represent that, and how the traditional healing space thinks is that the natural intelligence of the medicine is taken from the plant itself. No lab preservation, no clinical trial, no verification to tell us that this is THC for whatever it is. So we can't really put a litmus paper on it and say this is the one that we utilize.
Sharon, do you have anything to add to that?
I'm actually a traditional doctor, but I'm a Nyanga. I'm not a Sangoma. So Nyanga basically means we work with herbs. So at the end of the day, I also have studied many other modalities. So I don't work with one at all. For me, I'll never take on a cancer patient without an oncologist, for example. So it's really something. Every patient is different. Every patient should have their own protocol. And as a herbalist, I can't do what I do if the patient is actually not held by at least 3. We work with at least 3 doctors at any given time. For terminal and chronic diseases, there's no way that we can do it without it.
I think that's fantastic, and it speaks back to what we were talking about earlier about taking an integrative approach and holistic approach, because I do think that multiple practitioners are definitely better than just one, which is similar to cannabis, right? The whole is better than the individual parts. Oh, look at us mirroring the cannabis plant, I mean, that's just fantastic. So last few questions before we wrap up. So this question is from Wendy, and it says, do we know if vets administer the same for cancer treatments in pets? So there's no vets on the call, but maybe if you have any experience or if you know of whether the cannabis prescribed for animals is the same or similar to the cannabis prescribed and used in humans. Anyone?
Carmen, I can answer that because we have been working with animals for many years. Remember that an animal does have an endocannabinoid system just like we do. They're very different to us in dosage though. A dog, for example, doesn't have the same digestive system to what I have, so he metabolizes the oil very quickly. So different doses for different animals, but again, it's even better for animals than what it is for people in a way, because the animals just embrace it. You'll never see a dog not want to lick it out of your hand, or a horse, and we've treated cows and dogs and horses and, oh my word, such an array of animals with such beautiful, beautiful results. So anything with an endocannabinoid system, that means, I think the only things that I know.
Except insects, right?
Exactly, except
yeah,
I can't understand. But everything else, once I think we forget that as we're born, the first, the colostrum milk that we get from our mom, those first 3 days, what we're getting there is anandamide, THC. So every single human being, if they were breastfed, have already broken the law.
Right. So all those babies are all high, basically.
They basically all are given, as that baby is having that anandamide, it gives them the will to live, it allows them to suckle, and it gives them the appetite to start eating. It's huge.
Amazing. Oh, that's beautiful, Sharon. Wow, that's awesome. So perhaps one final question, and then this one is for Carissa. It says, have you found, it's from Rafika, sorry, I hope I have pronounced it right. Have you found cannabis as a good treatment for fibromyalgia, the mystical fibromyalgia?
Yes and no. I think it's highly individualized. It's not a fix-it-all for everybody, much like even our conventional drugs. The same thing doesn't work the same way for everybody. I think that there's a few sort of smaller studies that look promising, but at the moment it's sort of not generally advocated. But in my opinion, I would definitely try it if the patients are keen, if they are sort of motivated to give it a go. I am willing to work with any patient individually and give it a shot. So yeah, I think there is a role, like we said, with chronic pain, with arthritis. In theory, it's got an anti-inflammatory effect, definitely. So if we're keen, we should give it a go.
We are keen. Everyone here is keen.
Let's do it.
Thank you. Let's do it. I think I speak on behalf of the audience, and I've seen some of the messages coming through. They have thoroughly enjoyed this webinar. So thank you to each and every one of you for joining us and giving of your time and expertise to make the circle bigger. Just like encourage more people to learn about medical cannabis. And so I think that on behalf of the Chiba Cannabis Academy, I just want to say a big thank you to all our guests today, to Kelly, Christine, Carissa, Gogo, to Sharon. Thank you. And thank you to the Chiba Cannabis Academy, as well as Harold's Oil and Medical Marijuana 411 for this incredible webinar. I trust that you have learned something tonight. I trust that you are encouraged to join one of the courses, and we hope to see you soon at the roadshow if you're able to join us. So on that note, thank you guys very much for your time, and we wish you a fantastic evening ahead. Thank you. Bye.
Bye.